So, Sjogren's syndrome is an autoimmune disease that targets the lacrimal gland or crying glands and salivary gland. So, this results in a constellation of symptoms which includes glandular enlargement, dry eyes, and dry mouth. It also involves some extraglandular tissues like lymphoma. Sjogren's syndrome can be classified as primary and secondary. Primary involves the mouth and the eyes, whereas secondary overlaps with rheumatoid arthritis and other oral immune diseases. Let's see about the pathophysiology of Sjogren's syndrome. It involves B cell hyperactivity, which produces a variety of immunoglobulins like anti-Rho and anti-LAW. Secondly, it induces lymphocytic infiltration of the exocrine gland, causing dysfunction involving salivary and lacrimal gland. Let's see about the clinical features. The clinical feature comes with the mnemonic GEM. G stands for enlarged gland. It is due to chronic inflammation. It is firm and non-tender. It can be unilateral or bilateral, and it affects mainly the parotid gland. E stands for eyes that are dry and irritated due to reduction in the aqueous component of tears, which is medically called keratoconjunctivitis sicca. It gives gritty and sandy feeling to the eye. M stands for dry mouth, caused by chronic salivary hypofunction, which is medically called xerostomia. This increases the risk of dental caries and oral candidiasis. The next comes the extraglandular features of Sjogren's syndrome comes with the mnemonic MAP. M stands for malignancy, specifically lymphoma, the most serious complication of Sjogren's syndrome, and confers up to 9-fold increase in risk. The tumors are usually extranodal, that they arise within the exocrine gland. A stands for antibody deposition. A immune complex mediated disease often causes a strange vasculitis or dermatological stigmata like rash. P stands for periepithelialitis. This describes the immune response in ductal epithelial structures within a variety of organs like kidney. This results in interstitial nephritis. The other non-specific symptom of Sjogren's syndrome are Raynaud phenomena and fatigue. The investigation rely on the presence of significant sicca symptoms. They look for an evidence of an underlying autoimmunity and glandular changes. Autoimmunity can be shown in 3 ways. Firstly, a positive serology for anti-Rho and anti-LAW. Secondly, a biopsy of the minor salivary gland, which shows lymphocytic infiltration. Finally, patient with well-established systemic rheumatoid disease. Glandular changes. Firstly, Schirmer test, which measures tear production by placing a strip of paper over in the lower eyelid and quantifying how wet it becomes. Secondly, ocular surface staining can be done to empirically measure eye damage caused by dryness. Thirdly, whole cylometry, which is the method to quantify salivary hypofunction. Finally, imaging like an MRI or an ultrasound. Moving on, the actual management of Sjogren's syndrome is very basic and largely symptomatic. Sicca symptoms can be managed with artificial tear substitutes, cyclosporin eye drops, cholinergic drug. So, complication screening and treatment is also important to consider, especially for lymphoma and rheumatoid arthritis.